Hi guys. Okay, so this kind of presentation, whatever, is on injury management, and I should have done this years ago because it is probably the most common complaint question that comes up when it comes to training. And obviously, as a coach, I get questions every week. I get messages saying, "Oh, my shoulder hurts, my knee hurts, my this hurts, my that hurts," and like the vast majority of the time, like I would say more than 90% of the time, it is not actually an injury that you need to worry about. It's not something that you need to seek treatment for. It's simply part of being human and part of our physical experience in this world. And it's just not something to worry about. And I have come to believe that it's really important, especially for exercising individuals, anyone who takes, their fitness and their exercise seriously, to understand how to differentiate between pain that you can just manage yourself and pain that you need to seek professional help from. Are injuries that are very serious and that you need to get help for. But the vast majority of people go to physios and go to orthopedic doctors for or to osteopaths for things that they don't actually need them for. They don't actually need any sort of treatment for. They just need to know how to manage the injury, and it will pass over time. And everybody will experience pain and injury at some point in their lives, right? You will have musculoskeletal pain at some point. And I'm referring in this presentation, I'm talking specifically about musculoskeletal pain, okay? Something to do with the muscles or the skeletal system, right? And both people, it's really important to understand that both people who exercise and people who don't exercise have pain. But people who don't exercise have way more pain than people who do exercise. And there's a lot of people who believe, especially in like the older generation, the boomer generation, they tend to believe that exercise, like my family look at me lifting weights and they go, "Oh my God, Jen, isn't that going to fuck your back? Isn't that going to hurt your knees? Like, isn't squatting bad for your knees? Isn't running bad for you?" And it's like, no, not doing anything for like 5 decades is really bad for you. And what I'm doing is actually incredibly healthy. But I think that sort of belief sort of persists into our generation. And it's really important to realize that people who do not exercise experience far more pain and injury and quite debilitating pain and injury than people who do exercise. People who do exercise will still encounter pain and injury, right? It does decrease our rates of pain and injury a lot throughout the lifespan, but it will still happen. A lot of the time it will happen for no reason whatsoever, and you don't really need to do anything, and it's not really indicative of anything bad or anything you need to fix. Sometimes it will be because you did something stupid, especially if you're someone who's like me, really addicted to exercise and loves exercising and loves pushing herself. Like, then occasionally it will be because you did something a bit dumb, but that's not usually most people most of the time. So a bit of a backstory here as well. I've been a trainer for 10 years, right? And I see pain and injury every single week. I saw it when I was working in a gym, and I see it online. And as a trainer, I used to think I wanted to be a physio. And I went and did a 2-year course to be a sport therapist, which is kind of a halfway house between being a trainer and a physio. I basically wanted to understand pain and injury better. And for the most part, honestly, my course was kind of trash, right? It was a bit of a rubbish, just the whole approach was a bit outdated, just like I've spent a lot of years working with physios, and a lot of physiotherapy is also very, very outdated and very erroneous. A lot of, different techniques of physiotherapy that don't actually work. Same for osteotherapy and stuff like that. And there are also bad physios, and there are also bad doctors. But anyway, I wanted to know a bit more about that kind of world, and I wanted to be able to do more. Like, if I had a trainee with pain, I wanted to know what I could do as a trainer to help them. And more about what to do. And what I've mostly learned has come a little bit from that course, a lot from working with a couple of really good physios, or from just learning through doing and working with different people and with myself. Mostly, for the most part, okay, you don't need a degree in physiotherapy. You don't need to be a doctor to understand this stuff. For the most part, you just need a little bit of common sense and a rational mind. And you also need to have the ability to like listen to your body a little bit. I often joke about that on this program in general, that you don't need to be a rocket scientist to understand the basics of nutrition and fat loss and training, right? It's really not that complicated. The average trainer has an IQ of like 70. Like, this really isn't complicated stuff, okay? But it is poorly implemented, and there are lots of misconceptions. So this is why I want to teach you this, basically how to deal with 90% of aches and pains that you're going to get throughout the life cycle and from training, and what to do without having to go to a physio, and especially not an orthopedic doctor. In general, most of it comes down to people having poor management habits and poor reactions to pain and injury. So in my experience, people fall into one of two camps. They either keep pushing, they ignore pain, they don't listen to their body, they tell themselves no pain, no gain. They tell themselves things like no excuses, and they have this kind of like thing in their mind that if I go lighter, if I go easier, if I don't train today, if I rest, then I'm a failure, then I'm giving up, then I'm weak. I shouldn't be, making excuses for myself. I need to keep pushing. Or people fall into the other camp of just stop working out altogether. Any pain, they sort of panic, they freak out, they stop doing everything, and then they'll say things like squats are bad for my knees, or CrossFit isn't good for me, or lifting weights is bad for me, or I can't lift weights because of my back, or because I have a bad back, or whatever. And you might have heard me say something like this in a lot of other areas of nutrition, of fat loss, right? This tendency towards all or nothing, black and white thinking is very, very, very common in people, and they tend to do it. And you probably know which group you fall into, right? Like if you're really into lifting really, really heavy weights, you probably fall into the first group, right? And it probably covers pretty much everything in terms of your diet and your approach to exercise and your approach to training and your approach to injury. And if you're in the second group, you probably know that as well. There's this great book about communication and about how to talk to people when the stakes are high and there's a lot of pressure and there are a lot of feelings. And this great phrase has stuck with me for the rest of my life, that comes out in so many things, is that most people, when they're under pressure and when they're worried about what other people think or other people's reactions, they tend to resort to either silence or violence. Some people will just shut up and just not say anything. And some people will start screaming and throwing things. And then there's like nothing in between. And I am constantly amazed at how often people fall to the extremes in this way, and black and white thinking and all or nothing thinking in pretty much every topic in the world. So I've talked about how it applies to diet. And if you've been working with me for any period of time, you'll know that I'm really into the CBT stuff and understanding how your mind works about this stuff, and dealing with catastrophizing or all or nothing thinking. This obviously applies to more than just, diet and exercise and stuff like that. It also applies to politics and religion and stuff like that as well. My granddad, it was a very, very, very wise man in some ways. And he always used to say to me when I was a little girl, he used to say, there's a difference between scratching your ass and tearing it to pieces. Whenever I sort of like went off on one or like overreacted, this is what he would, or if somebody went to extreme on something, he would always say this. And it's a very, very, very wise thing. And it's just the lesson that's taught in Goldilocks and the Three Bears. And when you look at traditional, like children's stories, there is a reason why they became sort of part of the Western canon, or part of the body of stories that we tell to children, is because they teach something very fundamental about life. And that whole thing of like, not too hot, not too cold, just right. This is how we need to, this is an important lesson for children to learn and for adults to learn, because most adults I know don't actually know this or understand this concept. Podcast is called the healthy middle ground, right? Most of the time, there's this middle ground approach that doesn't involve going to one extreme or the other. So basically, in this presentation, what I want to teach you is to understand what pain and injuries are, like just very, very surface level, then how to manage day-to-day pain and injuries without having to go and see a physio, and how to know if you need to see a physio. Okay, so this is all about like not too much, not too little. You need to know when it's something that you can just deal with on your own, or that I can help you deal with. That's obviously my job, right, as a coach, but I want you to know. I'm your driving instructor, not your hairdresser, remember. I want you to know this stuff as well, about the right approach at the right time. You know, if you've broken your leg, obviously you're not gonna like try and fix that or just manage the pain and injury on your own. You're gonna go see a doctor. And it's important to know there is a cutoff point, right? You don't need to run and see a physio every time your back hurts or every time your knee hurts, right? That's overdoing it. That's really overcooking it. But also not going to see a doctor when you have serious pain or injury, or your bone sticking out of your leg, like they, you know, this is also silly. There's a middle ground here. Okay, so let's talk a little bit about understanding pain and injuries. This is some really important stuff, guys, right? It might seem boring, but most pain is transitory, right? Most pain will just come and go, right? The vast majority of pain that you experience, like every week as a trainer, I get people sending me a message saying, oh, my knees hurt this week in the squat. Can you give me a different exercise? No, I can't give you a different exercise. You just need to squat a lighter weight or figure out like how to manage the pain this week. And then next week, tomorrow, it will probably be gone. The vast majority of pain that you will experience will just sort of come and go in a random session, and you don't need to do anything. It will pass, right? You may need to manage load on the painful body part for that particular workout. So, you know, if your knee hurts when you're squatting, you might not want to just keep squatting even though it hurts, right? That might not be the best approach. But at the same time, it might not be the best approach to just not do anything at all and like just not squat that week. It might be best to reduce the load and do squats with less weight, or do squats with no weight, or just skip it this week if everything hurts, and it will probably be gone tomorrow. How many times this is the case? I wish I could do like an Excel and track how many times, like when people ask me about pain and then how quickly it's gone. Because sometimes I don't get a chance to even answer about the pain. And then the next day they're like, oh, never mind, it's gone, right? This is what most injury and most pain, that's not even an injury, most pain is going to be about, right? But sometimes it's going to go on for a bit longer period of time. It might bother you for a few days or a few weeks. But again, if you manage the load right, which I'm going to talk about later, it will probably just be something that will pass on its own, and you don't need any special treatment for. Another thing that's really important to understand about pain and injury is that most pain is not indicative of soft tissue damage. Most people think, oh, my back hurts, I must have a slipped disc. Oh, my knee hurts, I must have hurt my medial leg ligament, or I must have pulled a muscle, right? There's this great statistic that I love. 80% of people with slipped discs don't have back pain, and 80% of people with back pain don't have slipped discs. Okay, so the vast majority of pain actually isn't linked to any specific injury of any specific tissue. And this is something that's really hard for a lot of people to understand, because most people are like, oh, my knee hurts. What is it, doctor? Like, what specific tissue is hurt? Is it a ligament? Is it a muscle? Is it the bone? Is it the joint? Like, what specific tissue is injured? Most people want to know when they go and see a doctor or when they go and see a physio. But in like 99% of like instances of some kind of musculoskeletal pain, it won't actually be linked to any soft tissue damage whatsoever. And that was one of the biggest things that I learned early on as a trainer. And that, if there is soft tissue damage, or if I think there's soft tissue damage, I need to send someone to a physio. But if there's no injury to the tissue, then it's just something that I need to manage on my own with my trainee. And it's something that you can learn to manage on your own without a physio and without a trainer like me. So as I said, vast majority of pain is just a one-off and it will go. Sometimes it happens for a few sessions or weeks, and sometimes it's chronic, but still not necessarily indicative of soft tissue damage. And I'm going to give some examples a little bit later on from my life in this presentation. And most soft tissue damage, so actually injuring the tissue, is from either an acute event. So let's say you picked something up and it's way too heavy for you and then just fucks your back, or you were in a car crash, right? Or like you fell down the stairs and twisted your ankle, or somebody fell into you and you, or say like in a rugby match, right? And you tore your ACL. So it's from some kind of impact, some sudden impact, and you'll know that something's happened. Or it's from repetitive stress and usually pushing through pain. So for example, it's really common with runners, right? Runners need to run and they just run and run and run and run and run no matter what they feel. And the repetitive impact and repetitive stress on the joint, say on the knee or the ankle or on the hip, often when they're trying to block out the early warning signs of injury, right? That is when you end up with like a repetitive stress injury. And that can be simple, just straightforward, some kind of pain, which is more complicated, or it might be due to some sort of soft tissue damage. Like it could be due to worn down cartilage in the knee, but it's not necessarily due to some kind of tissue damage. Sometimes pain is from something else. Okay, so sometimes like pain is quite a complicated phenomenon, and it's not always indicative, and it's not usually indicative of tissue damage, although it can be, right? There's a sort of Venn diagram where they overlap, but they're not the same thing. And just because you have pain somewhere in your body does not mean that you have some kind of soft tissue damage, right? So I'll often get this when people say, oh, this specific muscle in my back is injured. And like, just because you're feeling it in a certain area probably doesn't mean that a certain muscle or a certain joint is injured. Like you're feeling it in a certain area, but that is not necessarily because of a certain tissue that's damaged. And pain this should kind of be the other way around. It says psychosocial and psychosocial. That's supposed to say psychosomatic, right? There's a really big psychosomatic element to it. I'm not saying all pain is in your head. I'm not saying we can think ourselves out of all pain, but there is a huge psychosomatic element. A couple of examples are our beliefs about pain matter. So people who think that they have a slipped disc, or if they have it confirmed that they have a slipped disc, they often experience more pain. But just if I go back to that statistic, 80% of people with slipped discs don't have pain and they don't even know it, right? So just knowing it can have a nocebo effect, right? Which is the opposite of a placebo effect. Our beliefs around pain, like, if you believe that you're, weak or frail, or like, you're worried about injuring your body, that can have a big impact on pain as well. And it also has a psychosocial component, like, whatever, like that's a bigger picture. Often catastrophizing about pain makes the pain worse. And I see a lot of that in my work. A lot of people catastrophizing and thinking that means that they can't use the injured body part, or thinking that it's, something way worse than it actually is. Again, this is not the only reason why we have pain, right? But it's a big component of it for some people, especially if you're a more neurotic, anxious personality type, that can come out in physical pain. But I should say that can affect how you experience pain, and it can be a significant component of it, although lots of other things can be factors. It's also important to realize exercise does not damage joints. Again, this is a real boomer belief. If you talk to my dad's generation, my grandmother's generation, they're like, oh, this looks horrible. This looks like this. They look at it and say, if I'm squatting something like 25 kilos, right, which is quite light for me, they'll be like, oh, they think about doing it in their bodies and they think that would break me, right? That would literally make my knees explode. And it probably would, right? And it would be too much load for them. So they immediately think that that's what it's doing to my body. But I've gradually built up to those weights over time, while I had healthy tissues. And so, I've built up a tolerance to it. That's what exercise does, is it basically builds up a tolerance to load, in particular, weightlifting or lifting weights or strength training. Same with things like running, right? Like it actually can, the impact can be really terrible for your knees if, you weigh 100 kilos, or if you haven't run for like 10 years and then you just go out and try and run 5K, right? It might really hurt like a lot of your tissues, and it might actually damage tissues, and it might not be particularly good for you. But if you build up a tolerance to it over time by starting to run a little bit, say like running 1 minute intervals and then building up to 2 minute intervals, and walking in between, you might be able to, your connective tissue, including things like your cartilage in your knees, will actually get thicker and stronger as a response to the impact, and then that will be protective for your joints. The same with lifting weights, right? You're not just trying to strengthen your muscles, you're also trying to strengthen the connective tissue and the joints, and they get stronger. The bones get stronger, the joints get stronger, the connective tissue gets stronger when you start with the appropriate weight for you at your level, and then you build up in weight over time. For example, I've had lots of clients who have started with body weight squats, and then over the course of many weeks have built up to 30, 40, 50 kilo squats, right? And their tissues have gotten stronger to be able to cope with that load. But if on day one I had just gone, let's just cut straight to the end and just put 50 kilos on your back, we probably would have caused a whole load of injury. Like we probably would have snapped their spine in half. I'm only joking, that wouldn't really happen. But you can cause spinal injury, you can cause injury to the joints, the muscles, bones, by loading too much too fast. So it's really important to remember there are no inherently bad exercises or movements or weights. There's just too much load too soon, okay? So this is so important to understand. Like squats aren't bad for your knees, deadlifts aren't bad for your back, running isn't bad for your knees. There's just too much load too soon. So again, putting 50 kilos on someone's back on day one when they haven't done anything for 10 years or when they're 3 months postpartum is a really bad idea, right? Trying to just get them to lift up 50 kilos from the floor, really bad idea. Trying to get them to run for 30 minutes straight when they're carrying 20 kilos too much body weight, probably a bad idea. Even if they're not overweight, they haven't run for a period of time, for like a few years, probably a bad idea, right? Like starting with less, starting with where a huge part of my training, one of the things I try and get across to you guys is start where you're at, not where you would like to be, not where you think you should be, not where you were when you were 26 or before you had kids, where you are now. And that can be very humbling, especially if you were strong in the past. Going back to training postpartum, really fucking hard, really humbling. But you have to start where you are now, and then you build gradually from there. So doing things with bad form, right? Like just doing shitty squats with bad form, like just adding more weight to it. Not a good idea. You gotta get the correct mobility, full range of motion. You've got to get the correct technique, and then you start loading. Also individual instances. So, if you weigh 100 kilos, box jumps, probably not a great idea. Running, probably not a great idea. Just because it's a lot of pressure through your joints. You may be able to build up a tolerance to it, but it's much better to lose the weight without impact and then start adding impact when you're a bit lighter. So there are individual instances where we have to to make things work with the individual, and that's just a really obvious example. There's an expression that I love: you can't make a baby in 1 month by getting 9 women pregnant. Making a baby just takes 9 months, right? Like there's nothing you can do. There's no pill you can take. There's no exercise you can do. There's no food you can eat that is going to make that happen faster. It takes 9 months. That's how long it takes. And like most injuries come from doing too much too soon, right? From trying to skip the building part of the process, the progressive overload part of the process, right? Progressive overload doesn't just apply to weights, it applies to running as well. If you haven't run for a decade again, it might be good to start walking first and then start doing intervals of 1 minute with walking in between, then increase to 1.5 minutes, then 2 minutes. And your joints and connective tissues get stronger as you go along, right? This process just takes a period of weeks or months to do. You can't just jump to the bit where you can run a 5K without injuring something, okay? And that's where the vast majority of injuries happen when it pertains to exercise. So it's kind of like trying to bake a cake at higher temperature, right? If you try to rush the process, you just end up with a burn outside and a raw inside of the cake. And it's the same with exercise. If you don't respect the process of progressing over time and starting where you're at and progressing in small increments over time, right? This is going to take you weeks and months, both when it comes to strength, all kinds of loading, strength training, lifting weights, and running, right? If you don't respect that process, you end up with injuries or you end up with injured tissues. Exercise only works if you start at the right level and progress at an appropriate pace. Okay. So, my auntie, my grandma, who look at me lifting heavy weights and they're like, oh God, that would injure me. Of course it would injure you because you're deconditioned. But if we started getting you squatting to a chair and then increasing that range of motion in that squat and then adding 1 kilo and then 2 kilos and then 5 kilos and then 1 kilo at a time until we get to heavier weights, in a few months, you'll be able to do a much heavier weight, but you can't rush that process. Most injuries happen through rushing that process or not accepting where you are at any given point, either at the beginning of the process or any given point along the progress. So I was at CrossFit this morning and there's a guy who always is complaining about bad knees, but then we were squatting and he was squatting way too much weight. His knees are all shaky. He's not going through full range of motion. His squat technique's shit. And then what does he do? He adds more weight to the bar and just tries to do more, right? He's not doing exercise right. And he's going to end up injuring himself if he hasn't already. And his knee pain is just going to get worse. Okay, so another example is my neighbor, right? She hasn't done any exercise for years, I think like a decade, right? And she's not that overweight. She's carrying a bit of extra weight like most people, but she's very, very, very unfit. So she starts running because that's what she used to do before she has kids. And she just goes out and she just runs for 30 minutes. And she gets all kinds of feet and knee pain. And I've had a few chats with her where she says, I can't get fit because I can't run. And I said, okay, well, what about walking for 30 minutes instead of running? She said, oh, it doesn't do anything. I said, okay, so what about running less each time? Maybe if you run for 10 minutes, you won't have feet and knee pain, but because you're pushing through pain. She says, oh, it doesn't do anything. I said, what about intervals? What about starting with walking for 30 minutes and doing 1 minute intervals, making sure that nothing hurts, and then you can increase from there? Oh, it doesn't do anything, right? Again, it's this all or nothing thinking about exercise in that I have to run for 30 minutes because, otherwise it didn't do anything, or because that's what I used to do, or whatever, right? It's the all or nothing thinking about exercise that gets people in trouble and gets people injured. She runs for 30 minutes. Everything hurts. Then she can't do anything for a month and she's hobbling around. And then she decides to go running again. She runs for 30 minutes, starts the whole cycle all over again. Instead of, if she listened to me and just did what I told her to do, like walking and then introducing intervals, after a few months, she'd probably be up to running 30 minutes without stopping, without any pain. But because she's trying to cut to the end bit and she's got all or nothing thinking about exercise, she's aggravating these aches and pains that she already has. And then she's not doing anything. And it's been about 3 years now that we've been having this conversation and she's not changing anything and it's not working. And she's been to see all kinds of physios and osteopaths and whatever, and nothing's making it better, right? This is the vast majority of injuries and pain in most people. And then again, this is where people say, oh, I can't run. It's not good for me. No, you can't run too much, right? If I ran a marathon today, never mind a marathon. If I I'm not a very good runner. If I ran a 5K today, I'd be super sore and I'd probably hurt myself and have to push through pain to do it, right? So it's all about the right loading at the right time and a bit of common sense. So let's talk about some guidelines, right? You've hurt your ankle, your knee hurts in the squats. Let's talk about what you can do. First of all, you need to understand the triggers. You need to understand what causes the pain. When do you feel the pain? Is it in certain exercises or movements? Is it during exercise? Is it after exercise, right? When does this happen? And this is the first thing. When you tell me as a client, my knee hurts or my shoulder hurts, whatever, these will be the first exercises that I asked you, like trying to determine what's causing the pain and when it's happening. Does it happen during your day-to-day life or all the time, or is it just when you're exercising? And also, how long has it been going on for? Has this been going on for a few weeks, or did this like start 5 minutes ago, right? Because again, like the way we approach it will be slightly different. We probably need to like approach this quite seriously, whereas, you know, if it just hurt in this last workout and it's never hurt before, let's see if it hurts tomorrow, first of all. Load management. This is probably the most important slide here. This is the most important thing that you need to understand about, and it's 90% of injury and pain management. If your knee hurts when you squat 50 kilos, I can't tell you how many times this happened. My knee hurt today squatting. How much did you squat? 50 kilos. Did you try squatting less weight? No. Why not? Oh, because I'm squatting 50, so I need to squat 50. No. Yeah, in general, yes, progressive overload, blah, 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 blah. But if your knee hurts when you're squatting 50 kilos, like you don't need to just keep pushing through it. Maybe if you reduce the weight, does it hurt when you squat 40? Or if that still hurts, does it hurt if you do 30 or an empty bar or no weight, right? And people will go, oh, what's the point of squatting no weight? Like I can squat 50. The point is about managing your health and mobility throughout the lifespan, right? Yes, progressive overload is important, but if today, this workout, your knee hurts when you're doing a certain weight, you don't need to just push through that, right? You just need to do less. And I can't tell you how many times I've had a workout where I'm going in, I'm going to squat heavy today, and then my knee hurts or something. And it's like, you just have to kind of manage it a little bit, figure out, like do something a little bit lighter. But then the next day it's gone, right? It happens. It happens to all of us, no matter how fit and healthy you are. And, you know, there's nothing wrong with you. It's just going to happen sometimes. If you find that like full range of motion hurts, right? Can you do partial range of motion? Again, it might be something that just passes in another day. It might be something chronic and you need to put a squat partial range of motion for a while. But, you know, you need to know if squat in either one of those cases, if squatting with less range of motion that doesn't cause pain. Shoulder hurts this week. Jen, I can't press with a barbell. Can you press with a dumbbell? If you can't press with a dumbbell, like with the same sort of weight, can you press with a lighter weight, right? And it doesn't matter how light this goes. Can you press with 3 kilos, with 1 kilo? Do what you can. Try, but an important thing that I didn't actually include here is like not to avoid those movements altogether. So what a lot of people do is they go, oh, it really hurts when I press 10 kilos overhead. So then they just avoid doing anything, or 5 kilos, whatever it is. So then they just avoid anything that looks like that. They avoid that movement. But no, you still actually need to use your shoulder, right? The body likes movement. It doesn't like being still, right? That's a big mistake that people make. Oh, my shoulder hurts. Oh, I'm just going to not move my shoulder. And then it just gets worse, right? Again, and that then plays into the psychosomatic thing and whatever. Can you do a downward facing dog? Can you hang off a bar? Can you do shoulder pass throughs, right? Can you move your shoulder through full range of motion? Can you do this movement, right? Even with no weight, right? Can you move it? Okay, no pain. Okay, great. 1 kilo. Can you do that? Okay, great. 2, 3 kilos. Can you do that? Right? Sometimes, and again, people will say, oh, but you know, I was pressing 30 kilos overhead. What's the point of doing 3 kilos? Well, you know, it's better than doing nothing. And that's a big part of injury management. Of, you know, moving the joint. It definitely involves moving the joint, even if it's without weight, spending more time on mobility, on the warm up. There's a great expression from like the 18th century or whatever, that is medicine is the art of amusing the patient while the body heals itself. And while that is not completely true of modern medicine, because like things have changed in the past 100 years, right? There's a lot of things that modern medicine does that, you know, we can't just, the body doesn't just, you know, fix itself like when you have a bacterial infection or whatever. But it is very true for 90% of like physio, musculoskeletal stuff, right? It's just about doing something else while the body heals itself. And you don't need treatment, you don't need special exercises, blah, blah, blah. This is supposed to say, don't push through pain, but some discomfort is normal. So a good guideline is 3 out of 10. So if you're doing 3 kilo shoulder presses and it feels a little bit uncomfortable, you can kind of feel there that it's bothering you, but 3 out of 10, that's okay, right? If it's like a 5 out of 10, 7 out of 10, and it's really hurting, right, then you want to deload, and keep deloading until you sort of, not until you've got no pain, but until you have like a little bit of pain or a little bit of discomfort. A big part of pain management is also about desensitizing the injured or painful body part, and like desensitizing it to movement. So sometimes we will have lingering pain in a body part that doesn't clear up, but we have to keep moving that body part even though there's a little bit of pain, and that pain is like a kind of residue of the injury that you had or of the pain that you had. The body kind of learns to feel pain, and then the pain kind of hangs around. Remember in the beginning I said pain is complicated, but this is one of the elements of it. And again, if we catastrophize about that and oh god, I must have a torn like whatever, like this ligament or that ligament, it gets worse, and we like go to the doctor and we go get scans, and we don't do any movement, we don't do any exercise in the meantime, right? Like this is not good for the injured body part, and most of the time it needs movement. It's still going to be a bit uncomfortable. The pain, again, is not indicative of any soft tissue image, but sometimes it's like it does linger and hang out. You have to kind of keep moving the body part in order to desensitize it to those certain movements that it's gotten used to feeling pain in. So an example of this was my shoulder postpartum after my third. There was no obvious cause for it. Like it just suddenly, and it didn't hurt before, but it just suddenly started hurting a few months postpartum. And I was already back to exercises, and I was already back to pressing overhead with a dumbbell, with a barbell. But then this pain was really bothering me in pressing movements, and I couldn't press overhead. I could do everything else with my arm, with my shoulder, but I couldn't press overhead. And at that point, I was already pressing like 10 or more kilos with one hand. So I was pressing significant weight, but I could only press like 3 kilos without pain on this shoulder. Now, a lot of people will say, what's the point of doing 3 kilos when I can do 10, right? But I showed up every week, twice a week. I did my 3 kilo dumbbell. I tried 4 kilo. Oh no, that really hurts. Okay, not going to do that. But then I did my reps with the 3 kilo. It took months, like 4 or 5 months, and I still had this pain. But after a few months, I was then able to do 4 kilos, and that was feeling better. And then 5 kilos, then 6 kilos, then 7 kilos. And then I was back to doing 10 kilos again. And then I was able to press with a barbell. It didn't happen overnight, but had I stopped doing it altogether, it's really frustrating when you can do heavier, but like, it hurts, and you can only do like a really pissy little weight. It can be really, really annoying. But had I not continued doing that, like showing up every week doing my fucking 3 kilo dumbbell, I probably would have persisted and gotten worse. But because I showed up and I did it and I kept doing it, eventually I was able to increase the weight. And now like there's no pain whatsoever. I don't even like, I kind of barely remember that it even happened. I panicked and I felt myself panicking and going, oh, maybe I've injured something. Maybe I started too soon. Maybe I need to stop doing this altogether. Oh, maybe I'm going to have shoulder pain now for the rest of my life. But the difference is that I notice those catastrophizing thoughts now, and I'm like, that's just my catastrophizing negative filter brain. That's what our brains do to us. We have a negative filter. Calm myself down and just show up and do what I can do, control the controllables. And it did get better over time. Now, managing the load, but also managing your thoughts around that, which should have been a separate slide, but I kind of forgot about that bit of it. I also do other overhead movements. So at one point I started snatching and catching the bar overhead, and that actually felt fine, which surprised me. I could do handstands with no pain. So I kept doing other overhead movements. And I could also train legs and other like upper body movements. I could do pulling movements. I could do pull-ups. I could do rows, no pain whatsoever there. So there's no reason to stop doing all of those things, right? So that's also an important thing, is to train around the injury and not give up altogether. Another important point is that most women need to be stronger, right? And yes, that some of you are lifting really heavy weights, and it's a kind of a different story. We need to, sometimes you're probably verging more on sometimes doing silly things, or sometimes not listening to the body, or sometimes doing too much, because that's how you're wired, right? That is a part of it for some people, but most women need to get stronger, right? Most of you need to get stronger. And the reason why you're getting pain and injuries all the time is not because of exercise. It's because you're under muscled, and some people are weak and frail and then get injured all the time. And what I would consider as weak, right, obviously not a very nice term, but let's not beat around the bush, is that you are weaker than your daily activities require of you. Okay, so if you hurt your back from just like picking your kids up, if you're like in constant pain in your knees from sort of like just carrying laundry or carrying the shopping bags or whatever, that's what I would consider as too weak, right? You're going to get injured because your daily activities require more strength of you than what you have. And so in those cases, it's really important to get stronger. And probably the reason why you're getting injured constantly or why you have pain is probably because you are weak. So this sort of group of women tend to injure themselves during daily tasks, and the solution is to get stronger, to lift weights. It's going to bulletproof your body, and you're going to be able to you're going to build up much more tolerance to movements and loads. Really important that I want to add in here because it comes up so often. If your back hurts, it's probably not because your core is weak. It's probably because your back is weak. So you don't need to do a ton of core exercises. You need to do some back exercises. In particular, you need to do deadlifts. Deadlifts are so good for building strength in the back. Squats are great too. Rows are also really important, but most important exercise is deadlifts and getting stronger in the deadlift. Can you be too strong? Like I said, about 10% of you are already lifting heavy weights. You push yourself really hard in workouts. You're doing CrossFit and you tend to push yourself very, very hard, and you tend to get injured because you do too bloody much in a workout or over a period of time, right? And not because you're doing too little, right? So this is another example of like when different things apply to different people and two different things can be true at the same time. If you are somebody who does CrossFit 5 times a week and lifts really, really, really heavy weights, right? It's the answer, the reason why you have pain or what you need to do when you have pain is not to exercise more. It's not to do CrossFit 6 times a week. It's not to squat heavier, right? It's probably to deload. It's probably to do a little bit less. It's probably to rest a little bit, okay? So different things apply to different people at different times. And also, if you're very, very strong, say like if you're squatting your body weight, right? Getting stronger will not help you deal with pain, okay? So if you squat your body weight or more than your body weight or whatever, and then you just keep having niggly back pain or knee pain or whatever, it's not because you're too weak and you need to get stronger. In fact, you probably need to take a little step back. You probably need to let things rest and recover, and then you can and manage load a little bit more, need a bit more rest and recovery, that kind of thing. Really getting injured from just picking things up in your day-to-day life, right? You need to do more exercise and more weights. And the irony is that because your personality type is, you will probably think, oh, I need to do less. I need to pick up less things. I need to pick up my kids less. And that will just lead you to getting weaker and more deconditioned, and then get in a cycle of getting injured more. And on the flip side of that, if you're somebody who pushes yourself really, really, really hard in workouts and you train really hard, if you start having pain, your personality will lead you to think, I need to do more. That's how I need to do more exercises. I need to do all these different physio exercises. I need to do heavier weights, and that will fix the problem. And the opposite is true, right? You need to do less, right? You need to deload. You need to let the body part recover. Which one you need to apply at which time is where the wisdom comes in, or the common sense comes in. And again, we have these personal tendencies that make us train one way or another. And you need to know which one you are, right? Like whether you need to train more to prevent pain, or if you need to train less to prevent pain. Here, guidelines are squatting and deadlifting half of your body weight. Now, if you're somebody who doesn't lift, you will think, fuck, that's heavy, right? And if you're somebody who does lift, you'll go, oh, that's really, really light. Okay. So again, this is how we tend to go to extremes. I would say if you weigh 60 kilos, you should be able to squat 30 kilos, right? At least for a few reps. You should definitely be able to deadlift 30 kilos, if not more weight. Okay. And if you can't deadlift and squat half your body weight, then you're probably in that first group of being too weak and needing to get stronger. And if you can squat more than half, deadlift half your body weight, you're probably in that second group of like, you probably need to do a bit less. Okay, so that's a good guideline in my opinion. This is not at all evidence-based or anything like that. That's just from my personal experience. So another guideline that I've touched on already is working around the injury. So if your knee hurts, right, there's no reason why you can't train your upper body, right? So many people do this. They have knee pain and then they just stop training altogether. I know it sucks to go to the gym and just do upper body twice a week, but if that's all you can do, that is so much better than stopping altogether, right? Like the body needs movement, and you moving other body parts will help, like, you know, with your circulating blood, circulating lymph, and that will help with the injured body part even without doing anything. Fit and strong and injury free throughout the lifespan. You know, if you've got a few months where your knee hurts, you can't just stop training altogether. You still want to do what you can do. Again, don't fall into that all or nothing thinking, and do what you can do. And that's the same for acute and chronic pain. So if your knee hurts just for one session, and you just need to do upper body, this applies. If your knee hurts for a year and you can only do upper body, this still applies, right? You still need to you still need to do it in both cases. And even I would go as far as like, if you do, you know, have a serious injury to your knee or break your leg or something, you should still be training upper body throughout that serious injury and rehabilitation process. Modify the exercises, but you still need to train. Change the exercise, right? If your knee hurts in squats, you don't need a different exercise. If your shoulder hurts in overhead presses, you don't need a different exercise. What a great rule of thumb that I should have written here again, but I haven't, is modify before you omit. Okay, so first of all, modify the movement. So can you do it with less weight? And if you can't do it with less weight, can you do it like a similar movement on that body part, right? So if I can't shoulder press, can I do like a lateral raise? Okay, if I really can't squat through any range of motion, can I lunge, right? Because it's a similar movement pattern, or it's a similar muscle group. Vast majority of the time, modify before you omit. So if you can do it with less weight or through less range of motion without pain, do that first. Don't just change the exercise or take it out of your program completely. Try to modify it first. And that's so important for injury management. Like if you can't squat 50 kilos, but you can squat with no weight, then you should be doing squats with no weight. And again, people will cut it out instead of doing squats with no weight, because they'll say, oh, it doesn't do anything. But like, it does a fuck of a lot more than doing nothing. Rest. Okay. Training is all about balancing training stress with rest and recovery. Again, there's two groups of people who tend to not do enough and people who tend to do way too much. And then there's nothing in between. Okay. A lot of my coaching programs are about trying to get people to be the in between, but it's really hard to get people to do that. Okay. So, if you're somebody who doesn't like exercise or is worried and anxious about an exercise hurting you, you'll tend to do less, and that will be bad for you. But if you are somebody who tends to push yourself too hard, you will tend to continue pushing yourself too hard, and that will be bad for your pain or injury. And you need to have the sort of wherewithal to figure out that you need to do the opposite of what your kind of instinct is. All the time, it's just about rest, right? You don't need 7,000 different exercises for your shoulder, for your internal rotators, external rotators, all these wanky physio exercises. You just need to rest the body part, or you just need to move it, a couple of times a week with reduced load, to a point where it doesn't hurt, and then you need to rest it the rest of the time, and not just like, so many injuries persist because people are doing like 70,000 different exercises 7-8 days a week and like never giving it a chance to rest. Another example from my life is that I had groin pain postpartum up to about 9 months postpartum, and it used to come and go. So I would sometimes go a couple of weeks without it happening at all, but it would always happen when I overdid it. I had a C-section. I've had 3 C-sections, and it was likely related to that, but also related to pregnancy, hormones, whatever, breastfeeding hormones. Again, we tend to look for the reason why it is. What is injured? What is the injured tissue? What has happened, or what is happening in my body? But pain is complex, and it's not normally due to something like that. But it would flare up every time. So this was a more chronic thing for me, and it would flare up whenever I did too many steps or spent too much time on my feet, or if I did too much lower body work. Again, it's really easy to catastrophize and go, oh, maybe I started too early, maybe I've done too much, maybe I'm going to have this pelvic pain for the rest of my life. But it did improve over time. It would happen. I would get flare-ups again when I did too much, because I'm that kind of personality type where I tend to do too much, not too little. And I can't sit still. So I'd be on my feet loads and loads and loads and go for long walks and things like that. And when I did too much, it would flare up. And then I would have to reel all the way back and really rest to at least to let the acute inflammation and the acute pain die down. I didn't stop altogether. Okay. So when it wasn't flared up, I tried to gradually increase my load. I tried to gradually, I failed sometimes, but I tried to gradually, being an important word, increase my step count, increase how much time I was spending on my feet, a lighter weights, or I didn't train and didn't walk when it flared up. So when it was really painful, I would just sit and watch TV all day or sit and work, because my work is and try to balance the rest and the rest and recovery on the one side, while also continuing to train on the other, and not, just become deconditioned in the rest of my body, lose all the muscle mass in the rest of my body, or lose all of my strength in my lower body. You have to manage the training stimulus with the rest and recovery. And you won't always get it right, especially if it's something that goes on for a long period of time, right? That kind of flares up. You're going to have to manage those flare-ups. But if you manage it right and get the right balance of training, especially if you're postpartum, training stimulus with rest and recovery, over time, it won't just stop altogether, but the flare-ups will become less frequent, they will become less intense, and they will take less time, so less duration over time. And now, I never get groin pain anymore, and it's all behind me. But at the time, it was, it was worrying that it was going to happen forever. That's an example of something that flares up and then it's fine in between. But, one example that comes up a lot with my clients is that suddenly they have knee pain doing squats. And I ask them, can they do less weight and just spend a little bit more time on mobility, a little bit more time warming up with no weight, a little bit more time maybe just on a bike, just warming it up a bit. And then they're like, oh yeah, it feels fine now, and they can squat. Okay. So that's another type, and differentiating between which one this is really important. Again, I'm your coach. I'm here to help you differentiate between, these different things. But it's something that you can also learn to differentiate yourself. Should you see a professional? First of all, if pain is chronic and bothers you in your everyday life, so if your knee hurts all the time and not just when you're doing squats, that might be a time to go and see a physio. If there was a specific event, or like for any long period of time, right? Not just for like 3 hours, okay? If there was a specific event, so if you twisted your ankle, obviously if you break your leg, if you have an ACL tear, right, like, which you're probably going to know about because you're probably going to be playing rugby or American football or something like that, and somebody comes in at the side of you, or you're in a car crash, right, you're probably going to know about these sort of big impacts, okay? So if there's a big impact and you feel something like tweak, but also if there's a huge amount of swelling, pain, or bruising, right? So with these tissue injuries that come from an impact, they will tend to get swollen and painful and have bruising as well, and very red in the area, right? If your knee's a bit sore today from squats, you probably won't see any swelling, a bit of pain, obviously, but not bruising, right? And it's just kind of come up. Or if it's even if it's just like something that's happened over a long period of time, also you won't get swelling and bruising. So another thing to add to this list is if you have like an impact that is very painful, then you want to go and check that out. I want to go and see a physio if these guidelines for load management don't work. And again, I'm not talking about like 5 minutes, right? These are gonna, like, sometimes you might have something for a few days or a few weeks or a few months. And I'm not encouraging you to just stay with the same pain for months, right? Like, if we're working one-on-one, I'm going to point you towards like going to see somebody. But over time, there are things that you can learn to, like, for example, like my shoulder or groin pain, where it was over a number of months, but there wasn't any reason to see a professional. Obviously, this is my job. I work with this. I have a lot of confidence to be able to do this. And I also have a great friend who's a physio who I will like consult with on these things. So I understand that it's not, something that's really obvious to most people. And you probably will go if you're feeling persistent pain in a certain area with certain movements. After a certain period of time of maybe like a couple of weeks or a few weeks or something like that, but over time your confidence might grow with these things. MRI or any kind of scan, you probably just need to see a physio. Again, like MRIs, they don't usually show the reason for pain because they will show injured tissue, but often pain doesn't actually have an injured tissue that will show up on an MRI scan or anything else. And often sometimes like you can get more pain because you've seen something on a MRI scan that has freaked you out. Orthopedic surgeons are often a hammer looking for a nail because the only thing they don't know any conservative exercise and pain management strategies. They know how to operate on bone and connective tissue, right? It's the only thing they know how to do. And they don't have more conservative measures. So they can often be, they make things way worse and just add loads and loads of fuel to the fire. And they should not be. In Israel, they're the first port of call for like pain and injuries, and they really should not be. You stupid things like, don't deadlift, it's bad for your back. Don't squat, it's bad for your back. Don't run, it's bad for your knees. Like whatever, right? They tell you silly things. They're not trained in exercise and proper exercise management. So a physio is normally the first port of call for these kind of aches and pains and stuff like that do persist. But you don't need to go and see a physio every time you have a little bit of back pain, okay? Like every time you feel like a little bit sore in your back or every time your knee hurts a little bit, you don't need to run to a physio. Most of these things you can just manage yourself and just go to physios when something persists and is chronic or causing you or interrupting your day-to-day life. And my final tip here is don't give up, because training around an injury can be really frustrating, especially if it goes on for a long time and especially if it holds you back from doing the things that you enjoy. So I had moments where I was just like, I just don't want to train with my because of my shoulder injury or my pelvic injury, especially when they both flared up at the same time. I was just like, you just can't do anything. But I knew I needed to keep moving. I needed to do something. I needed to like manage the injury. And like, it's hard to show up and keep doing that when you just want to go heavy, when you just want to do what you normally do. But showing up consistently allows you to train later on down the line and throughout the lifespan. Also, some people will be like, oh, this is so much work, this is so much energy. Honestly, if you've made it to the end of this video, which is like an hour long, like you probably won't be in that group. But like, this is a lot of effort. Like, I just want to do whatever, a really easy training program. It does require focus. It does require listening to your body. It's not a quick fix, but that is the point. And a lot of us are very, very disembodied and very disconnected from our bodies. And the common sense just goes out the window. Okay. So, it's really important to listen to your body, but also follow common sense guidelines and to not catastrophize. Anyway, I think that's it. In summary, most things don't need any sort of treatment. Most ache pains don't need any sort of treatment. It's just about load management, and just managing the loads over time, and it will go away. There are some cases where you do need to see a professional, but not in like 90% of the cases. And we all need to learn how to do this if we want to take exercise seriously, because it's just not feasible to run to a physio every week when something happens. Just, freak out and stop exercising altogether, because it's important for so many things, including mental health, as well as every aspect of physical health. Helpful. I hope it has changed a little bit about how you think about pain and injury and how to manage it. Let me know if you have any questions.